along, we're going to talk about risk factors. And so if there's one thing that I would like for you to take away from this topic for today, it would be about risk factors, whether that's about skin cancer, whether that's about cancer, whether that's about any health issue, is realizing that there's kind of two types of risk factors. There's modifiable risk factors, and then there's unmodifiable risk factors. So A, just knowing that the two exist, and then B, knowing from the risk factors which category those things fall into is really important as far as addressing an issue. So moving along, as we're back to skin cancer, so one of the risk factors is if you have lighter skin, you are at increased risk. So individuals that have fair skin are at increased risk. Individuals that have sensitive skin are at increased risk. And then going along those lines, individuals with red hair, individuals with blonde hair or light brown hair are also at increased risk. And then even individuals, interestingly, with blue eyes, green eyes, or gray eyes. I'm assuming that kind of still goes back to those individuals typically have fairer skin, but so that is a risk factor. So going back to that is not a modifiable risk factor. So the fact that you change your hair color does not mean that you're changing your risk. But so that's just one of those things you can't control. Another one that is unmodifiable is your family history of skin cancer. So if you have skin cancer in your history, in your family history, you're at increased risk. Also, if you have a personal history of skin cancer, you're at increased risk, which kind of just makes sense. But interestingly, those people that have had melanoma are 9 times more likely to have another melanoma than an individual that has never had a melanoma. And then individuals that have had the other two types are actually at increased risk of having a melanoma than somebody who's never had any sort of skin cancer, which kind of falls along the lines of other health issues. You know, somebody that's had a stroke is more than likely to have another stroke than an individual that has never had a stroke. So that's another one of, sorry, I'm being distracted by a dog. Another risk factor is exposure to UV light. So that is a big one. Your exposure to UV light, being out in the sun, and then in particular, whether you've had a history of sunburns. So not just any sunburns, but particularly the kind of sunburns that blister. So I think 5 or more particularly is concerning, but then also having those types of sunburns in your childhood also puts you at increased risk. So if you know me very well, I spent a lot of my time out in the sun as a kid, but so parents, you know, make sure you take care of your kids' skin. And then another risk factor is a history of indoor tanning. So that is one, if you can't tell, is completely modifiable. Just don't do indoor tanning beds, that sort of thing. And then individuals that have lots of moles, I just have to laugh at that one, I'm sorry. I'll come back to that in a second. But you are at increased risk if you have a lot of moles, and then particularly like a certain type of mole, you're at increased risk. And then lastly, which I thought was super interesting, is you're at increased risk for skin cancer if you have had a history of exposure to radiation, which is also sometimes a treatment. So I'm not quite sure how that one works, but it is one of the risk factors. So